Hi, I'm Dr. Broussard with the Wagon Train Veterinary Clinic, and in today's segment we're going to discuss feline heartworm disease. My assistant Lacey and I have put together a list of questions that we often are faced with. We're going to run through those questions together and hopefully give you a better understanding of feline heartworm disease. Lacey?
Dr. Broussard, what are heartworms?
Well, first off, let's start there. So heartworms are a physical worm. They are a parasite that is transmitted by the bite of an infected mosquito. And when that mosquito bites and implants the infective larvae into an animal, dog or cat, it makes its way through the tissues and ultimately will make its way to the heart, where it sets up shop and matures and then later on reproduces and what have you. So that is quite literally what it is. The parasite name is Filaria amidus is what it is if you want to look it up. But it is a true and physical parasite or worm that colonizes the heart.
How do cats get heartworms?
Well, the same way as a dog, to be quite honest with you. So as I just mentioned, they do get it from an infected mosquito. Let's back up for a second. So when a dog or a cat is infected with heartworm disease, and they have adults, male and female, those adults start to reproduce, okay? Once they do that, they will produce something called microfilaria. That's what I jokingly call the baby heartworms. When a mosquito feeds on that animal, they take in that microfilaria. It lives in the mosquito for about 2 weeks and ultimately becomes an infective stage larvae. And that is what that mosquito now goes and bites an unprotected dog or cat. And that's how the disease is transmitted, and that's how it goes, I guess you can say, full circle. It cannot go full circle in the same animal without the bite and involvement of a mosquito. Cannot happen. So the only way a dog or cat gets more and more heartworms is if they continually get bit by mosquitoes who are carrying heartworms, and that's how the disease worsens.
What do veterinarians recommend as heartworm prevention for felines?
Yeah, that's a good question. I think it's one that gets overlooked a lot, and I'm even guilty of sometimes forgetting to mention it in the room because heartworms is such a well-documented scenario in dogs that here where I practice in South Louisiana, it would be bordering on malpractice if you didn't discuss heartworms in dogs because it's so prevalent. In cats, sometimes people are not aware of it, they're not worried about it, or perhaps just because they haven't seen it before, so maybe that's why they're not worried about it. But to answer your question, there are products, most of them are topical, that can be given as heartworm preventatives for cats. The ones that I more routinely use are Revolution or Revolution Plus, which is a drug called selamectin. There's Advantage Multi, which contains moxidectin. I think Bravecto even has a variety now that they have had a new added. Bravecto is a flea and tick medicine, but I think now for the feline product, they've come out with one that has a heartworm preventative in it as well. And then lastly, there are some oral types like Interceptor's way back, but I know they still make it. Interceptor, I think Sentinel. There's certain heartworm products that are on the market for dogs orally. And sometimes the small dog sizes can also be used in cats as well. So there's plenty of options out there. Consult with your veterinarian and try to figure out something that works for you. I personally am just a fan of the topicals because there's very few cats that I know that enjoy taking a pill on a regular basis. So normally my choice is one of the topicals, and you don't have to fool with trying to pill a cat.
How will my veterinarian diagnose heartworms in my cat?
Now this gets to be somewhat of a tricky question because the disease in cats, again, is night and day different than it is in dogs. What does that mean? So it means 1 or 2 heartworms in a cat that's bad. It's a bad infection, and your cat may very well show clinical signs with only 1 or 2 heartworms. Why am I telling you this? Because 1 or 2 heartworms is going to be very difficult to pick up on the routine screening tests that we have available to us. In dogs on a daily basis, we use a heartworm antigen test. It looks for an antigen released from female heartworms. It's very specific. And it's not unusual for a dog to have 8, 10, maybe 15, 20 worms. So there's plenty of antigen there to be detected. If you're talking about a cat that has 1, 2 worms, which is not unusual, what if that 1 or 2 worms is not a female worm? Well, then it's not releasing this particular antigen. So it's a challenge to diagnose sometimes, but the antigen test is probably the most commonly used. There is another test that looks for antibodies against feline heartworms or heartworms. That one can be done, but it's kind of hit or miss. You can get a lot of false positives. All it simply means is that cat was exposed to heartworms at some point in their life. It doesn't necessarily mean that they are actively affected by heartworms now. So again, not 100% black and white test. And then I would tell you the third and final way that I'm aware of, if you're really good with ultrasounds, sometimes you can actually do a cardiac ultrasound and you may be fortunate enough to physically see the heartworm in the right atrium / ventricle in the cat's heart. Again, they don't have high numbers, so it would kind of have to be the perfect storm for that to happen, but that is a third alternative to be able to diagnose heartworms.
Why is early detection and diagnosis of heartworms so important for my cat?
Early detection and diagnosis of any disease would always be important. I would say that if I could potentially reword that question, I would say, why would early prevention be important? Because if your cat already has heartworms, the treatment options are very, very limited. Very limited. I'll just be honest, a lot of times it carries a fairly poor prognosis if you do diagnose a cat with heartworm disease. Prevention, that's the old expression, an ounce of prevention is worth a pound of cure. I think the guy that did it was a parasitologist who worked with feline heartworms, to be honest with you. So, no, I'm kidding. But it's just a much more, what I want to say virulent, but that's not the right word. It's just a much worse disease in in cats than it is in dogs. So preventing it is paramount. And if you live in an area that has mosquitoes that are prevalent, which pretty much anywhere in the Gulf Coast area or the southeastern United States, you can say, if mosquitoes are a big problem in that area, it's just safe and better medicine to just put a cat on heartworm preventative, whether they're inside or outside, because that's the other thing I hear a lot. Well, my cat's inside, he doesn't need it. Well, if you've ever had a mosquito in your house, I think your cat needs heartworm prevention. So that's my advice there. And is that it? Yep, I think that covers all the questions we had for this segment. I know it's a lot, guys, but it's interesting. And if you have any other questions, reach out to us. You can call us. You can come by the office. You can reach us through social media if that's easier for you. But I'll try to do my best to answer any questions you might have. Okay? Thanks for tuning in. We'll see you soon. Bye.